Hello everyone. So this is another short video. It's about nurse-nurse communication. So these are a few tips that you can use to communicate better with your colleague nurses. Number one, what the best thing to do always is to get a good start, right? Like anything else. So what does that mean? Starting right means that you pass on correct information, you coordinate, and you check in on all your colleague nurses. At the beginning of the day, give a proper handover, take a proper handover, coordinate activities amongst your colleague nurses, and check in frequently on your colleague nurses to make sure that they are doing okay with their patients in your eyes. Number one, starting right. Second is to build a rapport. That means be you should be able to communicate, you should be able to talk, you should be able to get things done with sisters or with nursing staff on your unit. You should know exactly who is good at what, and you should be able to talk to them in a friendly, cordial manner and get things done as quickly and as efficiently as possible. Building a rapport. Third, giving a heads up when things change. ICU is a very dynamic environment, right? So things change very, very fast here. So one moment patient may be good, one moment patient is very unstable. You would have planned for a scan or something later in that on that day, but suddenly patient has deteriorated, like GCS has fallen, suddenly patient needs a scan. So you can't wait for the older appointment. So when something like that happens, so you should be able to tell your colleagues, tell them that no, this is not, this was the initial plan, but now there's a change in plan, so we have to make all the changes according to that. So you have to take all the actions that are required. Talk to the doctor, talk to the, in the example that I said, talk to radiology, get a prior appointment, and arrange your team to transport the patient, just for an example. So, whenever there is a change, you should give a heads up. That means you should inform everybody around that there is a change and that there is a change in plan. Next, if somebody is telling you something and you don't understand, suppose senior sister or in charge sister is telling you something and you don't understand, just don't ignore it and say okay, it's all right. No, what you should do is you should ask, sister, I have not understood, what is it that you're saying? Or when somebody, say a doctor comes and tells you an oral medication or a test you don't understand, immediately ask, sir, what is this? Madam, what is this? Doctor, what is this? Please tell me what has to be done, how I have to send it. Okay, ask if you don't understand. The last most important is to disengage gossip. Gossip will ruin all relationships. So whenever somebody starts on your team, in your ICU, starts gossiping about somebody, you should immediately cut it out. How can you cut it out? There are a few techniques. One technique, if somebody is saying, say, bad about one person, okay, immediately you have to counter that by saying something positive about the same person. Okay, that makes a lot of difference. Immediately it will cut the gossip. Then another tool you can use is, you can just say, I don't know, I can't imagine what you people talk about me when I'm not around. So everybody knows that, oh, so she understands that if we are gossiping about one person, we are gossiping about the whole world. Okay, and gossip never does any good to anybody. So remember, when you talk to your colleague nurses and communicate, to start right, to build a good rapport with your team, to give a heads up when things change, to ask if you don't understand, and to disengage gossip. Okay, thank you.